20. The gastrointestinal system. A. Examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. Note if the abdomen is distended by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting, dullness, precuse, or tap. First, with the patient lying supine, flat on their back, then ask the patient to lie on one side and precuse again. If fluid is present, the dull note heard on percussion moves. Palpate H region, feeling for tenderness, pain when touched, or messes, palpable enlargement of tissue. Note also any guarding or rigidity shown by contraction of the abdominal muscles. Guarding may be due to tenderness of anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. Easy sign of peritonitis. Listen for vowel sounds. B. The feces. There are several words for the feces. Doctors sometimes say where there was blood in the stools. Have you passed black stools? Bowel movement is used to refer at defecation. Have your bowel moved today? Have you had bowel movement today? Bowel habit in a medical expression, meaning the pattern of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Patients sometimes say, my motions have been very loose lately. Change in bowel habit could be constipation, hard, infrequent stools or diarrhea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale. Hard, formed, semi-formed, soft, loose, liquid, watery. The color can vary from black due the altered blood as the melanin to yellow, gray, or even white. Malignant stools are often described as tarry, like tar, the black sticky substance that is used in road making. The stool may be red when fresh blood is present. Blood that can only be detected with a special test called fecal occult blood (FOB). When there is a high fat content, the stools are pale and are sometimes described in gray-colored. Stools that are large in bone are described as bulky. A bad smell is described as foul or offensive. 20.1. Complete the case report. Case 14. Physical examination revealed a thin girl with slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius. Pulse 100 for men. Blood pressure 110 for 80 mmHg. Examination of the rest of the cardiovascular and respiratory systems was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant and was associated with warding but not rigid. There was no rebound tenderness and no masses were felt. Bowel sounds were reduced. 20.2. Match the descriptions of the stools 1 to 6 with the combination most likely to cause then A to F using your medical knowledge. Type of tools and conditions. Loose bloody. C. Ulcerative colitis. 2. Loose pale bulky. E. Celiac disease. 3. Clay colored. Obstructive jaundice. F. 4. Black tarry. A. Gastric ulcer. 5. Small heart. B. Irritable bowel syndrome. 6. Clear, watery with mucus. Cholera. 20.3. Match the features 1 to 7 to doctor's questions A to G. Blood. 1. Blood. F. Have you passed blood stools? 2. Bowel habit. A. How often do you open your bowels? 3. Change in bowel habit. B. Are you going to the toilet more often than normal? 4. Bulk. Is the size or the amount of the stool normal? 5. Color. E. What about the appearance of the stools? 6. Consistency. C. Are the motions hard or loose? 7. Offensiveness. D. Do the motions have an unusual smell? Right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. 21. Chapter. Gynecology. A. The female reproductive system. Womb, ovary, neck of womb or cervix, fallopian tube, salpinx, and vagina. B. Menstruation. A period is the common name for a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes LMP 2/52. Ovum means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the from 4/28, which means lasting 4 days and occurring in every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods mean excessive blood loss. Menorrhagia, often with the passage of clots, coagulate blood. The term period pains mean dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause of climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of heat, and neck sweats. See a gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist and patient. Are your periods regular? Yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last usually? 4 or 5 days. Would you say they are light or heavy? Like. Do you get clots? No. Do you get period pains? No, not really. Is there any discharge between the periods? A little. What color is it? Is it white? D. Contraception. For women, methods to prevent pregnancy include the Europe contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, IUD, or Cooper coil. Condoms are available for both men and women.